Hello my beautiful nurses, good morning. Welcome back to my channel. My name is Saima. I provide information about OSCE, how to pass OSCE in one sitting. So my beautiful nurses, let's start the video. Thank you guys. So first thing I want to talk about is about assessment. This is the first station in the OSCE and make sure you do your best in this section. All right, this is the section where you do the assessment. You take the observations of the patient. You take if it's a MUST score, if it's PHQ-9, if it's a GCS neurological observation you need to take, make sure you document it. And the second thing I want to say is make sure you familiarize yourself with the plotting, with the calculations, how you document it. Make sure you familiarize yourself with the news chart, with the MUST score, with the GCS recording. Yeah, because it's very important to know how to document these things in the exam sections. Yeah, and also that before you respond to the patient, what they are telling to you, listen attentively to their concern before you respond. If they are telling you about the pain they have, make sure you ask them what's the rate of the pain. If you give them the score, like where would they rate it, make sure you ask that. Don't ignore the pain, don't ignore SOB. Yeah, even it's a minor things, it's not minor. It's not minor. So make sure you remember to acknowledge their concerns. Yeah, remember to acknowledge their concerns, whether it's pain, whether it's anxiety, whether it's insomnia, and then you escalate it to the doctor, or tell them that I will escalate it to the doctor. If there are things in your scope that you can do at that time, yeah, do it or escalate it to the doctor. And also if you check observations, yeah, you turn on the monitor, you take your blood pressure, you check the pulse and the heart rate, you check the pulse and respiration. Make sure you count it for 1 complete minute. If it's a mannequin, you don't need to do it, but you still verbalize that I will count the pulse for 1 complete minute, I will check the respiration for 1 complete minute, and then you document it. And if it's a real patient, don't turn on the monitor before you record your observations. Make sure you write them down on a paper, because you are going to document at the end. So make sure you don't turn it off. Yep. Here also throughout the exam, you need to remember that confidentiality is the important thing. You need to maintain privacy of the patient. You need to tell the patient that whatever information I'm getting from you, it will be kept confidential, and then I'm not going to share it with anybody unless only with the medical professionals. Yeah. And also you need to ask the patient for the reason of the admission, because most of the time students forget to ask the reason of the admission. So remember to ask the reason of the admission. Patient safety is dire important. Before you leave the patient, make sure you tell them that they will be checked time to time, and you pull the side rail up so they don't fall. Assessment is also the section where you do the activities of daily living. So ask the patient how this current condition has affected their activities of daily living, and you record them, because at the end of the section you're still documenting what are their activities of daily living and how you're going to help with them. If they are dependent, if they need your help or they can do by themselves, you need to document the self-care activities and all those things. So this is the stage where you're going to ask the patient about their activities of daily living. And if you have any concerns, you can still ask the patient. There will be no time in planning, in implementation, or in evaluation where you're going to ask the patient. This is the only station where you can ask the patient directly what are their concerns, what are their problems, where they are lacking their confidence in doing the things in activities of daily living. So just ask this question if you have any doubt at this point. And if you are doing malnutritional universal screening tool, MUST tool, make sure you remember that how you're going to calculate it. And if patient understand these things, what you are telling them, that what their score is and what it means to them. Yeah, make sure you health educate the patient in the assessment section. So if you are getting MUST, or what do you call it, the other one, PHQ-9, or news. So make sure you remember what are the things you need to do, and then you complete the section within the time frame. If you forget to ask the activities of daily living, how you gonna do it, how you gonna plan it later on in your section, in your planning, in your evaluation, how you gonna do it. So make sure you remember all the things at the time. In the exam it gets difficult, but if you practice it every day before the exam, you will remember it. Next thing we are going to talk about is in the planning section. In the planning section, you need to make sure that your handwriting is clear and legible and readable. So make sure you write accurately, and then the examiner or whoever is reading can understand your content, what you have provided, what you have written. And the other thing also, you need to complete all the section in the planning. You need to write nursing plan, you need to write aim of care, you need to write all the sections. You need to also provide what care you provided and the evaluation date. All the sections you need to complete. Make sure you don't skip any of these. Also in the beginning of the section, you need to write a patient name, patient date of birth, and NHS hospital number, all the details. And at the end also, for your details you need to document. You need to also write at least, if you can, write 5 or 6 patient the care you provided, and for patient self-care activities 5 to 6 if you can. Yeah, that's good. The next session we're going to talk about is implementation. Guys, honestly, I'm telling you, this is the long section, and most of the students, they don't complete it within the time frame. So what you can do about it, the most important thing here is to remember that you practice it. Practice at least 2 drug charts each day, and then practice reading aloud. And then talk to yourself what you are saying, what you're gonna do about this section. If paracetamol was given, when it was given, can I give it again? So you need to verbalize your thoughts at this section. Make sure you practice it, because it takes time to build the confidence to do it. Yeah, if cocodamol was given, and then you have paracetamol in your regular prescription, cocodamol was given in stat dose, this is the most common trap students fall in. Yeah, so make sure you remember cocodamol is paracetamol and codeine, so make sure you remember it. And then also there are medicines, they try to confuse you. Like sometimes they give in stat dose, and then they put again in the regular medication. Sometimes they give as PRN, and then they put again in the regular section. So you need to be in your senses, make yourself familiarized with the section. Yeah, since it's a medications, you need to check the allergy status of the patient. If the patient is allergic to this medicine, if they are allergic to penicillin and I'm giving Augmentin, make sure you remember it. And then also that you read the 6 hours of the medication, read them loud. And if I'm giving paracetamol, why am I giving it? And then what are the side effects, what are the effects, and they're not gonna ask you. Just for your knowledge, you need to know. If I'm giving cyclizine, why I'm giving it, because maybe the patient will ask, why are you giving me this medication, nurse? So prepare yourself that you are able to answer that questions. Also, before you give any medicine, you need to remember that you're gonna ask the patient if they are able to swallow the medication. If they have any swallowing difficulties, you need to consider the alternate. And at that time you cannot do it, but you can verbalize that if patient cannot swallow, I'll ask the doctor to put it in liquid dose, and maybe they need to refer to the salt or something like that. So just verbalize your concerns at this point. Check the patient's swallowing ability, and then check the patient 6 hours of the medication. Check the patient all the details before you give any medication. As I said, allergy status as well is most important. And then if you're giving the medication and patient is sitting in the right position, otherwise they're gonna choke. If you give them medicine, if you give them tablets when they're lying down, they may choke. So make sure, whether it's mannequin keep in mind whether it's mannequin or a real patient. So just tell them that I'll sit the patient upright before I give any tablet. And also sometimes students forget to lock the trolley. If you take any medicine from the trolley, just make sure that it was locked before you open it, and then you lock it after use. So make sure you do that. And also I said earlier, right, check the medicine why you're giving. If you're giving beta blockers, if you're giving digoxin, check for the heart rate, check for the blood pressure before you give any medication, because you are the one responsible for this condition. If for this situation, if you give tablet and if you give digoxin, their heart rate is already low, so it's gonna affect your status and your shift and your patient condition. So guys, remember, these are the basic things. These are the basic thing, and you know that you've been doing it in your clinical setting. Just don't forget them in the exam. Yeah, whether it's mannequin, think the mannequin as the real patient. Yeah, don't think that he's just a robot, he's just a mannequin. So it doesn't matter, because we are human being, we can forget. If a person there sitting there talking to you, you will feel that it's a real patient. But if they don't, but remember, assessor is responding to you for each of your question and answer. So they are responding, means they are the real patient. Just consider them as real patient. When you are done with your medication, make sure you document it, you record it. And then I would advise that if you're given the medication, still go through the start medication, PRN medications again. You cannot do anything if you have already given the medication, but you were not supposed to give. You cannot do anything at this point, but you can tell the assessor that I made a mistake. Sorry assessor, I made a mistake. What I will do in the real scenario, in the real setting, in the clinical setting, I will tell the doctor, I'll tell the nurse in charge, I will do whatever I can do possible for that patient. Yeah, whether you have completed all your section of the implementation, you have done it, but you have done it wrong. If you remember that you have done it wrong, just tell the assessor. Yeah, we are still human beings, we can make mistakes. Tell the assessor, maybe you will pass. Yeah, and then they'll still appreciate that you found out your mistake and you told the assessor. Please guys, if you make any mistake and you remember before the end of your exam, just tell the examiner. Whatever clinical skill you do, whatever, make sure that your patient is, whatever skill you do, whatever, whether it's assessment, whether it's implementation, or any clinical skill, make sure your patient is safe before you leave. Make sure you tell them that they will be checked time to time. You will be back after some time. You've given some medication. If you've given paracetamol, remember to come back and check on them later on. And also last but not least, we will talk about evaluation, which is the last section of the exam. So in the evaluation, what you're gonna do? In the evaluation, you need to write all the details that you have gathered from assessment, from planning, and from implementation. Make sure you document each and everything accurately and precisely. So what's the evaluation section look like? It look like this. Evaluation scenario. There are some notes for the candidate. Here will be the scenario, and then you need to document all the things. Yeah, sometimes they ask for a transfer of care letter, so you're gonna write a transfer of care letter. If it's a transfer of care letter, see, look at this, it says write patient details, then clearly describe reason for admission, initial admission and subsequent diagnosis. So in the patient detail, you need to write patient name, date of birth, and hospital number. Then the other section is clearly describe reason for any initial admission and subsequent diagnosis. So why the patient was admitted initially, and then what are the diagnoses we made later on. Just remember the word subsequent diagnosis. Yeah, it also asks for date of admission, identify the main nursing needs addressed during the patient stay in the hospital. Yeah, you need to document main nursing needs. You can write 2 or 3, doesn't matter. And then the third point is outline the nursing care provided to meet the identified needs. Evaluation is the section where you're gonna copy and paste all the things what you have written in the planning. So if you have done it correctly in the planning section, you are doing it correctly here. So here you're gonna write all the care provided in the planning section, you're gonna write it in the evaluation. You can write 5 to 6, as much as you want, doesn't matter, but make sure you write the good ones. Then the next section is outline the patient's current ability to self-care based on the person's care plan. So these are the self-care abilities, what patient can do for themselves. Same thing is from the planning section. We have done it before. We have done it, so we're gonna document it. And also the next point is document the patient allergies and associated reactions. If they have any allergy to anything, if they say I'm allergic to paracetamol, you can ask the patient, what happens if they take paracetamol? What's their reaction? They may say they get an anaphylactic reaction. They may say it's just the cough or something else. So make sure you document their reactions as well. And also list areas identified for health education. This is the point where you're gonna write that we have health educated the patient on this, this, and this. But what if you haven't health educated in the assessment section? This was the point I was saying. If patient is saying to you that I'm having pain, did you health educate the patient? We can give paracetamol, but before that, what is in my scope that I can do right away? You can reposition the patient. Maybe they'll feel comfortable if they are sitting upright, if they lie down. Yeah, so make sure you do what you can. If patient is telling me that I have insomnia, I cannot sleep at night, you can health educate them right away. You can tell them avoid caffeinated beverages at night, avoid taking hot drinks before you sleep, and this is the points, like basic things that you can tell to the patient right away. This is the way you health educate. So don't ignore. If they are telling you something, they say if I have constipation, what you gonna tell them? Drink lots of water, eat high fiber diet. Yeah, this is the health education you can give them right away. But if you don't health educate at that point, guys, what you gonna write it here in the evaluation section? What you will be writing then? They will watch your all video of the assessment in the camera, and then they will check. They can check that whether you have health educated or not. You cannot lie. So just make a routine of explaining the patient. If they're telling you something, just give them health education on the right point in the assessment. So in the assessment, there are loads of things that you need to do, guys. So make sure you practice, you familiarize yourself with all the techniques that I've told you. Practice makes a man perfect. Do it as much as you can before your exam. Do it with your friends, with your colleagues, with your roommate, with your flatmate, and then you can do it. I trust you guys. I know you can do it. Yeah, believe in yourself, be confident and practice. So I think I'm all right. I'm done for today. I tried my best to give you all the information that I have about OSCE, and then I hope they will help you pass your exam. If you like this video, please don't forget to share, like, and subscribe, and share it with your friends, with your colleagues, with your roommates if they are preparing for OSCE, and then it will be a way of helping me as well. Thank you for watching. Take care. Bye bye.